World of Dentistry. Dental solutions for your dental needs. Hello everyone. In this video, we will talk about a topic that worries many people who need to have their wisdom teeth extracted. What if the hole does not close? But first, it is important to know how wisdom teeth extraction is performed and what the healing and scaring process is like. Wisdom teeth are the teeth furthest back in the mouth. They are usually extracted when they do not have enough room to grow, are impacted, or cause dental problems. Depending upon the position of the tooth, two types of extraction can be performed: simple extraction or surgical extraction. Simple extraction is performed when the tooth is visible and in a good position in the mouth. The procedure is similar to extracting any other tooth. Anesthesia is applied, the tooth is released from the bone, and then removed with forceps. On the other hand, surgical extraction is performed when the tooth is inside the gum, or only part of the tooth is observed. An incision is made in the gum to uncover the tooth, the surrounding bone is removed, then the tooth is loosened and removed. In some cases, the tooth may need to be divided into several parts to extract it. After extraction, it is normal for an empty space to remain in the area where the tooth was located. This space is called an alveolus, and during the healing process, it will be covered with gum tissue and then filled with bone. The healing process after a wisdom tooth extraction occurs in several stages. During the first 24 to 48 hours, swelling, some bleeding, tenderness, and difficulty opening your mouth is normal. On the date of the extraction, a blood clot forms that is essential for the healing of the area. After a week, the hole begins to close, thanks to the regeneration of the gum tissue. At this stage, any stitches may be removed if they were placed. The gum closes 2 to 4 weeks after the extraction, but an indentation or depression may be perceived in the area since the alveolus has not finished healing. Finally, the socket can take 4 to 6 months to recover the bone tissue and fill in completely. Now, what happens if the wisdom tooth hole does not close? If there are no complications, the hole closes naturally within the established time frame. But if that doesn't happen, you may have a condition known as dry socket or alveolitis. Alveolitis is an inflammation of the alveolus and is usually painful. It occurs when the blood clot formed after a dental extraction dislodges or dissolves before the hole closes completely. Now that we know how a wisdom tooth extraction is done and how the healing process occurs, it is important to know what care must follow to ensure a speedy recovery and avoid complications. The first thing to keep in mind is to follow your dentist's instructions after the extraction regarding food, medication, and care of the area. It is normal to feel pain and have difficulties opening the mouth after an extraction, so it is recommended not to eat solid and hot food for the first few days after the procedure, and to avoid tobacco and alcohol, which can delay the healing process. It is equally important to maintain oral hygiene, gently brushing the teeth and tongue, and rinsing the mouth with warm salt water. This helps prevent the accumulation of bacteria in the area and reduces the risk of infection. If you experience severe pain, swelling, or fever after the extraction, you should see your dentist immediately, as these could be signs of complications. That's all for today. We hope this video has been useful to better understand today's topic. Don't forget to subscribe to our channel for more information.